Hi, I just want to talk about the recent virtual reality trial at Wimps Hospital in London and how concerning the results are, and the fact that 40% suffered severe pain after the virtual reality distraction technique, and that 75% suffered severe pain normally. Well, that's simply unacceptable, and the problem is that normally I've heard it said that they suggest oral analgesic, and we know, I won't name them, but we know there's only 4 that work, two NSAIDs and 2 opioids that work for procedural pain, and there's only one of each of those that's actually practical or really effective in any way, meaningful way, in outpatient hysteroscopy. And these Entonox, these the local, these really, I know the scope manufacturers offer more training. These, you should be using flexible hysteroscopes. I'm sure I have seen in a Freedom of Information Act that you're using scopes over 3.5mm. I'm sure I saw a 5.5mm scope mentioned. And I just don't know how to put this in a polite, non-confrontational way and constructive way, that whoever is doing, person or persons who's ever doing outpatient hysteroscopy at Wimps Hospital should no longer be doing them in outpatient. With pain scores like that, they are not fit for purpose. And let's face it, that time that Greek doctor actually perforated wounds and killed people, killed women. At the end of the day, we know that when someone's not up to standard, they do not get removed, they do not get stopped. Now, have pain scores always been that bad? Has there been a deterioration? I don't know, but the fact is they're not fit for outpatient, and that they need to be doing it no more than general and local conscious sedation. And been told that doing it under conscious sedation allows you to keep the best practice tariff, because that's what this is all about. Is that this is about money? Because with the pain scores that were in, none of the 7s, 8s, none of the 8s, 9s and 10s pain scores were stopped and converted to a general anaesthetic. That means no one at your hospital is being the patient's advocate. No one cares, or they do and they're just blanking it out. I do know that there's a matron at Kingston Hospital that's putting together a training package for HCAs and nurses that would allow them to train them to be the patient's advocate and to stop procedures at an acceptable pain level. So perhaps that might be helpful, but the reality is that the pain scores that are coming in, do not kid yourselves that women will die because of this, because they will refuse or delay treatment till it's absolutely necessary or too late. Do not kid yourselves that this has consequences. This has consequences far greater than someone's upset or in pain because of it. Outpatient hysteroscopy, it has long living effects, and I'm really concerned that this has gone on, that no one really seems to care, and no one is the patient's advocate. Why will someone simply not stop? Or at the end of the day, they're choosing outpatient because you're not telling them the truth. You're not telling them that 75% of women suffer severe pain. You're not telling them that there's a chance of post-traumatic stress syndrome, PTSD. You're not telling them the truth. You're not telling them that it's an invasive, painful procedure, and we're doing it because we make money off it rather than send you to a day case. You really do need conscious sedation in this situation. As I say, there are techniques that can help reduce it, but why is the figure so high? Why? There's something fundamentally wrong and I just simply have my doubts that anything will be done about it, that they'll carry on and think that everything is okay when it's not.